All right, good morning everyone. Good morning Queensland, and a very good morning to all of our Facebook Live followers this morning as well. Thank you for joining us. And of course we are still in the southeastern Townsville in the lockdown, and I want to give Queenslanders an update about where we are. So today I can report we've got 4 new cases, 2 are overseas acquired detected in hotel quarantine, and 2 are local. Now of those 2 local, some good news there. One is a close contact of the Portuguese restaurant, and they're already in quarantine, so very good news there. And the second one is a 37-year-old woman. She works at the Qatar check-in counter at the International Airport. She was unwell. She went for a test on Tuesday. It came back positive yesterday. She has been to very limited places around her local area, so Dr. Young will give you an update about that. But we are very encouraged at the moment that we've only really got those 2 cases. So very encouraging news today. Can I also add, as well as that, we've got to look at the whole situation. We have had record tests in the past 24 hours. I want to thank every single Queenslander who has come out and got tested. We've had 29,990 tests. Well done. And of course, we have had, again, a record vaccines delivered, 18,162 by Queensland Health. So that, of course, is fantastic news. So all of this, the fact that we've had a large number of testing, plus we are not seeing more wide-scale community cases, is very, very encouraging. So I thank Queenslanders, but we're not out of the woods yet. We've still got another 24 hours to go to see what happens over the next 24 hours, and we'll update you tomorrow in relation to whether or not we can lift that lockdown. But like I said, it is very, very encouraging news at this stage. So I might hand over to Dr. Young to give some updates about that, and we're happy to take some questions.
Thank you, Premier. So yes, encouraging news for Queensland. The most encouraged I've been is the amount of testing. I really and truly thank every single person who's come forward for testing, and our new case today came forward early and got tested. So we need to just keep doing that, and we know we can manage all of these risks going forward. So our new case today, who I believe has probably acquired it at our international airport. So she works at the check-in counter for Qatar Airlines. So that means she would be checking in not only the passengers, but she would be involved with the crew. And we do know that international flight crew are high risk. So they don't stay here for 14 days after they fly into the country. They fly in and they fly out. So we don't always know which of them are positive, which is why I really and truly insist people must wear masks at the international airport and at our domestic airports. That is really critical. You don't know who might be infectious as you're walking around that airport. So it's really important. So this lady in her 30s became symptomatic on the 27th of June. So that means her infectious period goes back to last Friday. Now, we're speaking to her at the moment to get all of her contact tracing achieved. So she does have another person who lives in the same household who we're urgently testing, and we're testing close contacts. But I've got some preliminary information that might be helpful. So she attended Officeworks in North Lakes on the 25th of June. We're just trying to clarify those times. She went to Coles at Marumba Downs on the 27th of June in the early afternoon. And of course, I'll be looking at QR codes and looking at all of that information that we've asked people to collect. So that will be critical. Then she attends regularly Anytime Fitness in Griffith. So I don't have the actual days yet. We'll put all that up on our website. Then she was with her colleagues from Menzies Aviation, who provide the staff for a lot of the work that's done at the International Airport. She was with those colleagues on the 26th and the 28th of June, so we'll be going through that. So all of that needs to be worked through, and as soon as we get any of that confirmed, we'll put it up on our website and get it out to you. So just reiterating then the other cases. So the other locally acquired case is related to that alpha variant from that Portuguese restaurant outbreak, if I could call it that, and they went into hotel quarantine from when they were identified. So they've been in hotel quarantine for their entire infectious period, so it's no risk at all. And then we have those other two overseas acquired cases that were picked up on day one in hotel quarantine for both of them. One came from South Africa transiting through Singapore, and the other one we're still getting that travel history. So we're now at 1,700 total cases since the start of the pandemic here in Queensland. 43 of them are active today, and we did those 29,990 tests on 29,473 people, which is not a record, but it's very, very, very close to it. So to date, we've done 2.9 million tests in Queensland on 1.8 million people. And we gave record numbers of vaccines yesterday, so that now 1.46 million doses of vaccine have been delivered in Queensland. 1.15 million of those are dose 1 and 0.29 million dose 2, or 290,000. So I reiterate my message: if you are 60 years of age or over, you should go to your GP or one of the Commonwealth clinics and get vaccinated with AstraZeneca. If you've already had one dose of a vaccine, you need to go and get your second dose. 12 weeks after the first dose of AstraZeneca, which I will be doing on the 31st of August, or 3 weeks after the first dose of Pfizer. That can extend out to 4 weeks. There is no problem with that, because I know there have been some issues getting appointments for people, but we're keeping a very, very close eye on that. If you are 40 through to 59 years of age, you should be booking in to a clinic to get Pfizer. Now, as of next week, the Commonwealth is sending out Pfizer vaccine to over 230 GPs across Queensland. So you will be able to book into GPs to get Pfizer if you are 40 through to 59, or you are in that 1A or 1B group and you haven't already had a dose of AstraZeneca. So that's really important. So people should keep a close eye on the website for when those appointments become available. We will be focused here in Queensland Health on second doses, because we're only getting around that 66,000 or so doses a week, so we need to prioritise second doses. So thank you to all of those people who've been coming forward and booking, and we hope to be able to go ahead with all of those bookings. It's unlikely we can do walk-ins just because of the large number of second doses that we need to do, and they are an absolute priority, of course, for us. Thank you.
Thank you, Premier. Well, as you've already heard, these are very, very promising results on day 2 of the South East Queensland lockdown. Near record levels of testing, a low number of community cases, a record number of vaccinations in Queensland. We did import 2 further cases of COVID-19 through overseas travellers into our hotel quarantine system. There were 189 international arrivals that went into hotel quarantine yesterday alone. We don't know how many of them were vaccinated. We do know some will have COVID-19. We have very little information about why they were permitted to travel. I just want to touch on Border Force disputing the Australian Bureau of Statistics figures on passenger arrivals yesterday. And in doing so, they pointed to an average proportion of travellers who were Australian across the pandemic. They did not dispute the growing trend for an increased number of foreign nationals being permitted vaccinated to travel. And if you look at that ABS report, that's what it points to. It points to an increase in the number of foreigners travelling here, as well as an increase in the number of Australians travelling since the borders were well closed last year. In fact, from May last year to May this year, almost 184% increase. From some countries, a more than 400% increase. And if you look just between April and May 2021, 9 out of the 10 top countries saw an increase in people travelling here, and there was an increase across every single visa category. I note there's been some analysis today of arrival card data, which also confirms that high level of people travelling for leisure and business purposes. I think when Australians think about international travel, when the borders are closed and think about hotel quarantine, they think about Australians coming home or the occasional highly skilled worker needed here, or genuine hardship cases. They don't think about people coming and going about their regular business. The Minister herself admitted yesterday there were more than 13,000 people admitted who are permitted to come and go and have been utilising hotel quarantine on multiple occasions. I think Australians expect that these travellers should be vaccinated, and we should have confidence that they are vaccinated. Returning travellers and hotel quarantine come at great cost and risk to Queenslanders. The federal government makes the decision about whether people can come, but that cost is borne by Queensland taxpayers and the COVID risk is borne by Queenslanders. As we say, there are 189 international travellers who went into hotel quarantine yesterday. We also put 116 domestic arrivals into hotel quarantine, including 51 from Darwin, 43 from Perth, and 41 identified close contacts of existing positive cases. Within our existing hotel quarantine capacity, we only have 140 rooms becoming available today, and so the police can outline how they are rushing now to expand hotel quarantine capacity for people we know that will arrive today, and it's too late to avoid that, but it just reiterates the need for that urgent reduction in the cap on returning travellers, as well as how important it is that we start ensuring that travellers are vaccinated.
Thank you, and I just want to thank everyone for coming out and getting testing. Incredible numbers in the last 24 hours, and also the vaccinations. Can I ask the public just to be patient? We know that there's long lines at our testing clinics. Please regularly check the website as we are expanding the hours of centres, and also in Townsville we'll be setting up a second site today as well. We've got 8 lanes running at double staff and capacity at 1,300 smiles in Townsville, and we've got QML have established a private drive-through at JCU with 3 lanes and going to 4 lanes tomorrow. And we also, as I say, are looking at standing up an extra site. So we know in some areas, particularly Townsville, and we thank all the people in Townsville coming out and getting tested, there has been long lines. Also, I had reports this morning that some of the public waiting to be vaccinated, and particularly at the Sunshine Coast vaccination site, were becoming abusive of our staff because they wanted to be assured that they'll be able to get their second vaccination with shortage of supply. Can I ask the public to be respectful to our staff who are working tirelessly to get Queenslanders vaccinated? And whether it's testing staff or vaccination, we are so grateful for our health workers and what they are doing each and every day. They don't deserve any abuse in the roles that they're undertaking. We know people are anxious. We know people want to get tested and vaccinated. We respect that, but we also want you to respect our workforce and what they are doing to keep us safe. In relation to the investigation, in relation to the individual working outside of a COVID ward unvaccinated, we've appointed Dr. Paul Griffin, who is the Director of Infectious Disease at Mater Health, to lead the investigation. He will specifically be looking at how it came to be that this individual was working where they were unvaccinated. In doing that, he will also be looking at the systems that are in place at that hospital to determine who is a worker that must be vaccinated to work in those areas and who deems that area as being a mandatory vaccination area or not. Obviously, that work will start immediately, looking at the systems and the processes for the decision making. It will be some time before any interview can be done with the individual herself, because we are very mindful that she is a COVID positive patient in a COVID ward currently, and we must respect that her health care comes first, but that will not delay the other work that can be done in the investigation. I can also advise that letters are going out today to our 5 hospitals that manage COVID patients. So this is the Cairns Hospital, Sunshine Coast University Hospital, Gold Coast Hospital, RBWH and the Prince Charles, asking them, based on what we now know with the new variant and particularly Delta and its how contagious it is, asking them why we shouldn't expand our mandatory vaccination group to be the entire hospital staff where there are COVID wards, to overcome the issue of trying to define who is and who is not working around a COVID ward. Every time we have had transmission, we have looked at how we can improve our processes. Every jurisdiction has done this that has had an outbreak, whether in hotel quarantine or in our hospital system, to learn the lessons of what we can do better, but also to look at the changing nature of these variants and the risk profile. We know the risk profile has gone up. We know we need to do even more to protect our health workers and our community. I'm very mindful that tens of thousands of health workers around the world have died, have been infected while doing their job. We have been very, very fortunate that very few have been infected in doing their job here in Queensland, but we can't relax and we can't become complacent. We need to do more. What that means is we are wanting to investigate the risks of the catering staff in the kitchen handling any equipment that might come out of a COVID ward, the laundry people, and what sheets and other fabrics might come out, or towels might come out of the COVID ward, the pathology staff who are managing all of the swabs. So we want to have a much broader look and a much broader definition of who is our 1A workers who are potentially at risk in relation to any contact with COVID positive patients. So we'll be writing to them today. I've already spoken to, met virtually with other stakeholders, the AMA and ASMOF and all the unions, both yesterday and the day before, to flag the expansion of our mandatory vaccination group, and have spoken to them also about the potential that these 5 hospitals that manage COVID patients are all requiring vaccination. So we'll work with all those stakeholders in the hospitals to ensure that we put in place the best methods we can. We must remember that health workers across the country are not mandated to be vaccinated. National Cabinet has not mandated any group other than aged care workers to be vaccinated. Now, despite this, we had already mandated anyone working in hotel quarantine or around COVID patients to have to be vaccinated, but we want to do more, knowing that this Delta variant is so contagious and is going to put more people at risk. In relation to the queries around the Commonwealth's request for people under 40 to get vaccinated by AstraZeneca and to consult their GP, I know there was some commentary yesterday about whether it was just GPs that were going to be consulting under 40s. My understanding, based on information that was sent to us by the Office of the Coordinator General, National COVID Vaccine Task Force, is that they were opening up access to primary care sites. So we read this as Commonwealth sites as well, and I understand the clinic finder includes Commonwealth vaccination sites. So we do just want to make sure that anyone going to those Commonwealth sites are going to have the opportunity to talk to a medical physician and be able to have that conversation around informed consent as well. If they're going to other primary care sites that are beyond GPs, and it specifically says We're preparing advice on the changes to send directly to GPs and other primary care providers. So we just want to make sure with the Commonwealth that if under 40s are requesting AstraZeneca to other primary care providers other than GPs, that they are making sure that they're getting that informed or that advice for informed consent.
Thank you. Deputy Commissioner.
I'll echo the Premier's comments around the position we're in, and also that we've seen very good compliance from our community, with one or two exceptions which I'll come to shortly. So overall, we have seen very good compliance, although since we commenced the recent restrictions, we've handed out 225 masks to members of our community who were not wearing masks. We've done 158 business inspections and responded to 78 calls for service that have been specifically COVID related. Out of that, since I reported to you yesterday about the infringement notice in Nambour, we've only seen one more fine given out, which was for a female, 49-year-old female at Moray Field, who again, when confronted by police and requested to wear a mask, just simply refused to do so. So they had no alternative but to take action. At our vehicle borders, so on the roads into New South Wales in particular, 1,315 vehicles intercepted, only 2 turned around, so again, very low numbers there, which we're pleased with. At our domestic airports, 1,826 persons are processed and only 8 having to be turned around. We are seeing an increase in domestic quarantine requirements with the advent of the hotspots in Northern Territory and West Australia, and we had 51 persons coming out of the Northern Territory and 43 out of West Australia that had to go into hotel quarantine. And yesterday we saw within the cap 189 persons arrive from overseas that had to go into hotel quarantine, and we are seeing some significant numbers outside the cap with specific areas such as the ADF and people coming in. So all of this puts pressure on our system. So we're working very hard to make sure that we can stay on top of that. I just wanted to finish off by commenting on the vision that was around the beaches in particular yesterday. That's very disappointing. It's really quite clear the purposes why people can leave their residences. Going to lie on the beach and get a suntan is not one of them. If people want to go to the beaches to exercise, that's fine, provided they're within their local area. And if they are out there, they are still required to wear a mask unless they are actually in the process of exercising. So that was quite disappointing. Having said that, our police engaged people, were given the opportunity to comply, and they did. Nonetheless, there are taskings today, and if we can't get compliance on our beaches, we'll have no alternative but to work with councils and start putting some barricades and things up. Thank you.
Just to clarify on the new cases, so none of the other members of that receptionist household have tested positive so far, other than the brother?
Yep, the only test is that brother, yes.
So the other 3
Have tested negative, that's correct.
does that give you then?
A lot of confidence, absolutely, yes.
Are you surprised there have been no other cases from that receptionist anywhere, given the fact?
It's too early. We've got to see 14 days. So these 3 days that we're in at the moment in lockdown gives us the opportunity to make sure we've found everyone and we've got them in quarantine. So you can see from that Portuguese restaurant cluster, all of the cases we're picking up from there are in quarantine. So I'm not at all concerned about them. But it's too early to be confident we won't get more cases.
Given these results, are you more encouraged that we might be out of lockdown at 6 o'clock tomorrow night?
I am very encouraged, yes. But can I say we've got another 24 hours. So I now have 5 incidents that we're having to manage, with this additional one related to the international airport. So that's a lot. Each incident in of itself, I'm pretty confident about. They've all been very well managed and they're lower risk, but 5 of them simultaneously is a lot. So we'll just have to wait and see how we go.
Just regarding that Qatar checking.
Oh, yeah, thank you. That's a very, very good question. I forgot to mention it. Thank you very much. So, as you know, we usually, because we've got a superb pathology lab that just can do genome sequencing so quickly. They really are, leading in the world in terms of their capacity. They won't be able to for this international airport worker because her CT values were very high, which means she doesn't have much virus, which is very good in terms of her risk of spreading it to other people, but it means we won't be able to sequence it. So we'll just have to wait for another 24 hours to do another test on her to see if we can get more virus so that we can then sequence it. So I won't have a result on her. Very, very unlikely, I'll put it, that I'll have a result on which variant by the end of today.
We've been contacted by someone who works for Bentley's Aviation to say there are many, many workers out there, ground staff,
Yep.
handlers who have not been vaccinated.
That-
Does that concern you?
It concerns me enormously, and we have put in place processes to assist people at the airport to get vaccinated. And I know, because people have told me, they've said they work in an office and so they're getting vaccinated. So they know they can be vaccinated, they just haven't come forward. So it's really, really important that anyone working at our international airport, and I've also enabled it for other airports, but particularly our international airport, which I recognise is, of course, Commonwealth property, and I don't wish to go over them, but anyone who works at our international airport, Queensland Health will vaccinate, and it's really important they come forward and get vaccinated. The 25th till yesterday.
You've been accused of scaremongering by GPs over your comments on AstraZeneca yesterday. Did you go too far in your comments yesterday with relation to the AstraZeneca vaccine under 40?
No, I just put out the facts. My advice is very, very clearly that people who are 60 years of age or older should be going to their GP or a Commonwealth vaccine clinic to get AstraZeneca. Anyone under 60, if you've already had one dose of the vaccine, you need a second dose of the same vaccine, whether it's Pfizer or AstraZeneca. If you haven't had your first dose and you are under the age of 60 and at least 16 years of age, then you should be scheduling yourself as soon as it becomes available to you to get the Pfizer vaccine.
But should it be an individual discussion with GPs? Isn't that the crux of the ATAGI advice?
All vaccination should be an individual discussion with your GP, because there are some people who definitely should not be getting AstraZeneca, no matter what age they are. So there are 4 very specific conditions that you shouldn't be getting AstraZeneca. So those people need to talk that through with their GP, who will refer them to one of our clinics and they'll get Pfizer. And similarly...
Sorry, you spoke about 18-year-olds dying from vaccines yesterday. You spoke about an 18-year-old getting AstraZeneca vaccine and dying from a blood clot. Don't you think that is scaremongering? The Premier backed you up with those comments. Do you regret those comments now?
No, that is the truth, that there is a risk that you can die from one of those rare, and they're rare, blood clots, and the younger you are, the more likely it is it will happen. As you get older, and that's why ATAGI set the upper age at 60, because if you look at the data, the risk significantly decreases over the age of 60. But the younger you are, the higher the risk. And we have had no one in Australia, or talk about Queensland, we have had 7 deaths in Queensland, and they're all people over the age of 60.
What about a
We're in a race to
19-year-old?
get vaccinated. Doesn't this undermine the vaccination program, though? When you have doctors such as yourself, the Chief Health Officer, coming out and saying people shouldn't get vaccinated with the AstraZeneca vaccine at the age between 18 and 40. Instead, the federal government saying, go talk to your GP.
I am giving my advice. I'm a doctor. I've been involved in Australia's vaccination program now for 16 years. I have got the vaccination rate here for our little ones, up to 5 years old, up to 95%. I am on the record as supporting vaccination, but I want the right vaccine to go to the right person.
What about a 19-year-old, Dr. Young, who can have AstraZeneca immediately or wait 6 months for Pfizer? Surely, in that situation, they would be better off having AstraZeneca immediately if they had, for instance, an elevated risk.
Why are they waiting for 6 months, sorry?
The example
I'm not.
They can have AstraZeneca.
It's October.
Well, sorry, Dr. Young.
No,
They can have
please, can I just stop all this? This is getting absolutely silly. So I've put my advice out there very, very clearly. Now, people need to work out where they want to get advice from. They need to, I have every day, virtually, in the last 18 months, come out and given Queenslanders the best advice I can possibly give them. I commit that I will continue to do that. And this is my advice. People, of course, can go and get their own advice. They can get it from wherever they wish to get it. But my advice is very, very
The
clear.
Queensland government's own website says that the Pfizer and AstraZeneca COVID-19 vaccines have been approved to adults aged 16 years of age.
That's correct.
You don't agree with that advice?
No, it's correct. That is true. TGA has approved the use of those vaccines. My advice is that if you're under 40, you wait and get the Pfizer or the Moderna vaccine.
There's a study out that I saw yesterday that the incidence of side effects from aspirin is higher than AstraZeneca.
Yes, but it doesn't tend to kill you.
Can I clarify please, is there a number of close contacts with all the cases we've had so far? And I guess how many of those have been tested? How many are in isolation?
We've got thousands of close contacts, and every single one we make an assessment of, and that's why quite a number of them have gone into hotel quarantine, and you've heard me come out and say that we've got another person related to that cluster who's in hotel quarantine who's tested positive. So whenever we get a close contact, we assess their risk of transmission, whether they've got suitable premises. If they don't, they go into hotel quarantine. But we're up to thousands.
Yes.
Why should they put up with this political bickering and blame shifting? Can't you all agree as leaders at a time like this?
Yeah, well, exactly. That's what we're planning to do, and that's what I've been trying to do. But unfortunately, there was a misrepresentation about something that did not happen at National Cabinet. And I'm still waiting to hear how Federal Cabinet approved it. But let me say this very clearly. In the next 3 months, and I've always said this, we have been advised that there is going to be plentiful supply of Pfizer and Moderna. So in the last quarter of this year, and I've said this on several occasions, for the majority of the population to get vaccinated. We are pro-vaccination. Now let me say this too about Dr. Young. Dr. Young is one of the most respected health professionals in this country. She has given Queenslanders the very best advice that has kept us safe. Not only has it kept us safe, but it's actually allowed our economy to open up faster than most other places in Australia. So my advice to everyone is, in Queensland, other states can listen to their own premiers and their own chief health officers, is to listen to the advice that Dr. Young has provided. And then, as she has said, that individuals can go and have their own consultation with their own GP. We want Australia to be vaccinated as carefully and safely as possible. I want to see a situation in Queensland where the majority of Queenslanders get their vaccination, because that will give us so much confidence to be able to do so much more. So please, everyone, let's have some,
We have this manipulation stunt yesterday where you had your health minister get up and say, we've tried to get all these Pfizer vaccines.
I'm sorry, I don't know your name. You haven't
My
been.
name's Bianca Stone.
Oh, hi, Bianca.
Sunrise, the show that
Yep.
didn't appear on this morning. Yeah.
Well, I'm not going to answer people being rude. So anyone else have a question? You are being very
Your
rude.
Twitter account, you said even the UK government won't allow their under 40s to get the AstraZeneca vaccine.
Yes.
That is false.
Well, there is an article that talks about under 40s to be given an alternative to the AstraZeneca.
But your Twitter account says that your Twitter account says clearly that the UK government won't.
No,
allow
actually,
it.
you weren't
That
here
is
yesterday
false.
either, and actually read from the article, so I'm happy to provide you a copy of that article.
I can quote your Twitter account. So
That's what I'm happy to.
The UK government will not allow the UK government. Sorry, Premier.
No, I'm sorry. Let's do one at a time.
Well, Premier, can you answer the question then?
Yeah, I actually released the article and I spoke to it yesterday.
But your Twitter account says that the UK government won't allow AstraZeneca for under 40s. The UK government will allow it for under 40s. Were you being
Well,
purposefully
no,
misled?
definitely not.
Premier,
Yes, Donna.
Queenslanders deserve an apology over what's happened at Prince Charles.
Look, I apologised when we went into lockdown. I said I apologise to Queenslanders to go into the lockdown. I'm more than happy to apologise. No one wants to see this happen, but as everyone knows, our systems are stretched. So today I've written to reduce our caps by 50%. I think that's really, really important. As you heard, we are down to the final number of beds. We are now searching for additional hotels for our hotel quarantine. This virus is incredibly contagious. It is the Delta virus. Our hotels were not built to contain it, and obviously you see that our hospitals are not built to contain it either. Yes.
Vaccination hubs, you said the federal government was setting some up.
The health minister talked about that in a letter that came. Yep.
The Prime Minister's office says that that's incorrect.
Well, there's a letter the health minister just read from.
Guarantee
Yes.
that the-
No, one at a time. Who hasn't had a turn? Claire? Lydia?
Expanding the mandatory people who are getting vaccinated, shouldn't that already have been done?
Sorry?
Right into their
It is actually not it is not a national cabinet decision. So the other day, and it's a really good decision that national cabinet endorsed about the aged care workforce being mandated to be vaccinated, and now we're actually going a step further in Queensland for our health workforce.
But expanding that definition, shouldn't that have already?
Well, as you can see in other parts of the country, you've got nurses who are unvaccinated that are actually going about their business that have become positive. So, look, I honestly think this is probably going to be something that has to be looked at nationally as well.
Any lessons though, Premier, from
Yes.
the PA hospital and what happened there?
Yeah, we did, and you know, this is the highly infectious strains. It is incredibly hard to contain. And as I said the other day, we're in a pressure cooker situation, and we all need to work together. Yes. So,
Who've been quarantined here in Queensland, the ones Stephen Miles spoke about,
Yes.
will not be on the same floor as international travellers, so we don't see what happened with the Bendigo miner.
yes, we have that actually came out of National Cabinet as well. So what we've done is they are on separate floors. We're actually looking at having a separate hotel. So the police are working on that at the moment, which is some great work that they're undertaking. The Deputy Commissioner briefed me on that this morning along with the Commissioner.
I just want to bring it back to that point. You're saying you're not misleading the public, but clearly...
Oh, look, I'll go and have a look at the tweet. I came here, I read from the piece of paper, okay? I'm happy to look at that. Sorry?
What's going to happen if health workers say they don't want the vaccine?
Look, we're going to have a long conversation with them because it's just so important that people get vaccinated. And like I said, I want to see a situation where the majority of Queenslanders get vaccinated. Two last questions. Yes, Lydia?
You and the Deputy Premier have said that quarantine facilities should be used for vulnerable Australians returning. Do you still plan to travel to Japan, and do you think that...
Yeah, well, I'll say a couple of things about that. So first of all, if we're in a situation like this, of course, I will not be attending. Secondly, the Prime Minister went overseas on official national business, and the Olympics are official state business. Now, let me also say this about the Olympics. The one thing that is standing out for the International Olympic Committee is the cooperation between national, state and local. And there is a very high expectation that there is a federal minister there if the Prime Minister cannot attend, that the Premier is there from the state of Queensland, and that the Lord Mayor is there from Brisbane. I also, yes, I've said very clearly, if I attend, I will come back and do 14 days of mandatory hotel quarantine. And I've also said that people leaving should be vaccinated. My understanding is anyone who is going to the Olympics, whether they be journalists, the official party, or Olympians or training staff, have to be vaccinated. So my point has always been that people leaving Australia should be vaccinated, and anyone coming into Australia should be vaccinated. Last question, Rachel. Last question. Thank you. Sorry?
With Magnetic Island,
Yes.
people waited 8 hours yesterday and weren't able to get
Yeah,
a
look-
test. I noted that some more testing clinics have been set up in
Yes.
Townsville, but what about the island?
Yeah, I think, look, thank you, and I do understand that there has been some long queues there as well. Look, we're trying to get to people as quickly as possible, and can I honestly thank people for coming out and getting tested. Everyone is trying to do the right thing here, and fingers crossed that we will have low numbers tomorrow and we'll be able to lift the lockdown. Thank you. Thank you. Thank you.
You're asking questions. 4 million people deserve masters.